Hello, welcome everybody to Lunch with Ferg, Dry Eye Beyond the Drops. Dry eye symptoms are some of the most common complaints heard by eye doctors. Dry eye, itchy, red eyes, even wet and watery eyes. Many times patients think that these are symptoms that they have to live with or forced to carry around a bottle of eye drops. But that's simply not true. People just don't know that there are treatments available, proven solutions that don't just help with symptoms, they can actually improve the health of your eyes and preserve your precious gift of sight. Thankfully, we have one of the country's leading experts on dry eye right here live. I'd like to introduce Dr. Stephen Ferguson with Dunes Eye Consultants in Dakota Dunes. He's the Vision Medical Director of Dunes Eye's Dry Eye and Tear Film Center of Excellence, and today we're going to talk about dry eye disease, the causes, and how he's helped thousands of patients like our guest today, Jan McKenna. We're going to talk with her here shortly later on in the stream. Aside from that, just discomfort of dry eye disease and even the risks and untreated effects of dry eye disease. And without further ado, Dr. Ferguson, if you want to take it away, tell us a little bit about dry eye. What is it?
Well, thank you. And thank you to Kaleidoscope Marketing. And thank you for Jan for being present today to give a little bit of a patient perspective. But, dry eye disease is so prevalent. Their estimates range from 45 million U.S. patients. And we believe in the clinical perspective, it's probably higher because dry eye doesn't always manifest with symptoms. You can have a lower tear base and really not have really that much symptoms. So it's a very complex problem. And there's a lot of little pieces of the puzzle that contribute to why patients either have symptoms or evidence of damage to the surface of their eye. But the thing that's interesting to me is how patients that have this problem do not seek out eye doctors. They believe that using just over-the-counter drops is a treatment or a therapeutic option. And in reality, that's a concern because the disease can progress to become a little bit of a symptom to a really aggressive inflammatory problem. And so if patients are out there seeking, a better solution, we have great options that we can treat the root causes of dry eye. Dry eye is broken into two categories, typically. Low volume, or what we consider evaporative, where the tears evaporate from the surface rapidly. And so you can think about that as the major cause. Almost 90% of patients that have symptomatic dry eye or clinical dry eye have evaporative components, and that comes from the glands of the eyelid, the meibomian glands. And you hear a term called MGD. MGD means the glands are dysfunctional, they're either blocked or they're not producing good oil. So that creates a fragile tear film. That tear film is susceptible to breaking down from lack of blinking or environments like wind, fan, low humidity. And the result is instability on the surface that can lead to irritation, unstable vision, and here's the kicker, watering. Where does the watering come from? It comes from a second set of glands that are like the sprinkler system for the eye. So if the eye is irritated, your eyes water. It's a protective mechanism, but it's not the same basic formulation of your natural tears. So if you cry, your eyes are often irritated because these are the accessory tears. So that's where the watering can come from. And so that's a little bit of a simplistic overview, but think of dry eye problems as having two possible causes: lack of volume or poor quality. And many patients have combined mechanism, meaning they have both of these. So you have to address both of them. We can do that. We have the capabilities of doing that.
And you've talked a little bit about the symptoms that patients might be experiencing, but at what point, there might be people watching right now, they're rubbing their eyes. How do you know, for a patient perspective, at what point do you say this might be dry eye disease if they think that it might be just their contacts or just allergies?
Well, that's a great question because all three of those things are what patients think. So first of all, let's just start with allergies. Many people believe their allergies are their dry eye. Allergies are difficult because you could have a pristine, high quality tear base, and then the punch gets spiked because allergies create inflammation. So you really have to have a separate evaluation of the allergy component and the actual tear functions, if you will. So that's a great point. And there are in this world we live around here, patients often have both allergies and dry eye, and you have to have a plan for both to keep the surface happy. Contact lenses do not cause dryness per se. A patient that has a fragile tear film is more susceptible to contact lenses bothering them. So it's a stress test. If you have a beautiful, robust, healthy tears, you can wear any contact lens pretty much. Okay, they don't create problems. But the more fragile your tears are, and your tear base and your tear film, if you will, or consistency, the more susceptible you are that certain contact lenses will bother you. And there's many patients go, yeah, but I tried three lenses and I found one I liked. Well, you found the right compatible material and base amount of water content that's keeping you pretty happy, but you still have an underlying problem. It might be classified as mild, which many patients are at that early stage. But a contact lens is always what we call a stress test. If I have a patient that comes in and has tried one material of contacts, tries another, and says, wait, he's like, I just pretty much say, listen, why don't we quit messing around? Let's go back and fix your dry eye problem. Then you're going to be able to be successful in wearing your lenses the way you want. So those are two very very good questions as it relates to typical relationships, what patients think.
So, what causes the tear film to actually break down, and how does this impact not just comfort, but the actual vision quality and the health of patients' eyes?
Oh, that's a loaded question with a lot of great content to add. First of all, think of the tears as windshield wiper fluid, and the lids are the wipers. You have to have a very stable, consistent amount of tears to keep your vision good. The tears are also called a refractive lens. It's very interesting, the optics of the eye. Without proper tears, your vision blurs, okay, and is inconsistent. Many patients will come in, have no symptoms. They're saying, my vision's gotten blurry. And I put a tiny plug in the tear drain to raise the volume, and with immediately their vision's better. So it shows the power of what the tears are. So they're very impactful on vision. So that's something we have to always sort of keep in mind. As far as what else can happen, well, you start with the oil glands starting to change their consistency. I say early stage MGD, as we say, basically you need an oil change. You need your glands cleared out. You need to get the plaque off your teeth. Get the plaque out. Reset. In early stage, that's a very easy thing for us to do. But if you let things progress, then we start getting what's called ocular surface disease, which is inflammation. Inflammation on the surface of the eye takes on a whole new sort of secondary component of this. And that inflammation creates irritation, blurred vision, a lot of reflex, a lot of things that are associated with this. So many of the advertised medicines that you see, Restasis, Xiidra, Cequa, they're anti-inflammatories. They're trying to suppress inflammation and control the health of the surface, but they don't address the underlying cause. They don't address the MGD or the low volume. They just try to support the surface. So it's a complex topic. And so I hope that I give you a little bit of clarity on that with that answer.
No, yeah, that's perfect. I do have a note here to potentially talk about different treatment philosophies. Is there
Yeah,
anything
yeah,
there?
absolutely. Yeah, I think we've touched on it already. Interventional, go fix the cause. Get the dirty pool water cleaned, get rid of the contributing things that make it dirty, stabilize that, and give the patient's tears a chance to support their surface. That's what we're naturally given is tears to make our surface stay healthy and also provide consistent vision. Tears are way more complex than blood. They have way more biochemical components to them. And I think when you tell patients that, they're like, wow. So if your blood's not normal, you're not feeling well, there's problems. Same thing with tears, right? So I often use that analogy to describe interventional treatment, fixing the cause. The other approach is supportive. trying to make patients feel better. That's why they get artificial tears. They throw a drop in, ah, that feels good, right? Or I'm going to get some Zydra Restasis or Mibo, a new one. And Mibo is a great drop. We use it as a support if we cannot fix the oil glands to the degree we want because there's limitations to a patient. Mibo becomes a great drop to use, especially as we get older. So it's all about making you feel better, but it does not address the underlying factors that are causing the problem. Most eye care providers are supportive treaters. Okay. Not as many practices do interventional treatment, which is unfortunate. Okay. Because you can reduce costs to the healthcare system over long term and reduce out of pocket costs for patients long term by treating it interventionally.
Perfect. Yeah, and I really like those metaphors that you have for dry eye. But let's shift now to talk a little bit about LipiFlow specifically because you've been prescribing this for years and we're actually involved in its development. How does this
Yeah.
treatment work differently from, say, OTC drops?
Yeah, good question. It's an interventional treatment for the oil glands. I actually was an early adopter of the technology when it became FDA approved, and I actually helped support learn helping get the company to get it into a clinical approach. So that's where I was helped in. I mean, helped getting it into a clinical approach for patients to be able to use this. I was the first patient in South Dakota to have LipiFlow treatment, by the way, because I also have dry eye. LipiFlow was the very first interventional treatment FDA approved for MGD. There's others. There's TearCare, there's iLux. So other companies have similar types of treatment options, but basically you're trying to do gland clearance. In MGD, the glands get obstructed. So you're essentially trying to open the glands and clear them out. That's what that does. There's also more to the story. And what makes the difference is being able to address how to create a recipe for a patient with that treatment to get everything rehabilitated. So it's not so simple as just go get the treatment. You also need to have us do a diagnostic evaluation and apply the appropriate recipe to the individual's eyes to get the best potential results. The reason we selected LipiFlow, it was had the most FDA studies. We understand the mechanism. We have great outcomes, but that doesn't mean that other alternative options couldn't work. And there's something called IPL, which is called intense pulse light therapy, that does a similar thing, and that's become very popular. Not not as efficient. You have to go in for a series of these treatments, like going into almost like a medical spa, and they can do these things. And it's maybe not as long term of benefits that we see with our LipiFlow program. But we're experienced. We've done as much of this as anybody in the country. At one time, our practice had performed more LipiFlow treatments as individual doctors than anybody in the United States. I'm not sure that's true anymore, but we've been heavily involved for a long time.
And what can patients like Jan realistically expect during and after a LipiFlow treatment?
So, what you experience, and I will share my experience as a patient, and then Jan can offer her experience. The first thing that you notice after the treatment initially is, man, you feel good. You've got all this extra oil, and that first experience is really good. But then, because the glands have cleared, you may not feel as nice as you were right after the treatment. It takes time to sort of recover. It's over those first 2 to 4 weeks, it takes a little bit to restabilize. But we often see patients then over the next typically 2 to 3 months continuing to improve and stabilize. But the key is what we do as an eye doctor to manage the rehabilitation of the oil glands. I look at each patient and prescribe a little bit of a recipe to ensure we get clean oil, glands are open, and optimize tear volume, and then control all the things that can pollute the tears coming from the lid margin and or allergies. So those are things that you have to look at in each case to get the optimized result. But most of the time, it's pretty comfortable moving forward, and we give supportive care initially in those first few weeks as well.
Dr. Ferguson, I have a couple more questions for you, but I think now might be a good time to ask Jan a few. Jan,
Sure.
before you saw Dr. Ferguson, how was dry eye disease affecting your daily life, and what activities either became more difficult, uncomfortable?
Well, thank you. And I just want to say I'm so glad to be here today and listen to Doctor. And I want to thank Joe too for having me on. I have to say, listening to Doctor right now, everything what he's saying is exactly what I'm feeling right now. When I first went to him, it was after my own doctor. And my own doctor said he didn't even believe in lippy flow. And I thought, that's interesting. But I found myself with this dry eye feeling. I had like irritation, achy eyes, headaches, constant irritation. And I was putting drops in, and I put any kind of drops in, not anything special. And I also was not blinking. I wasn't blinking enough. And my eyeballs felt like there was rocks underneath them. Well, also to let you know, I was a teacher at the time and we had moved into a new building. So I was blaming it on the new building because, of all the dust from building it and everything, that's maybe what caused my irritation of eyes. And I went that way, but that wasn't necessarily it. I found when I was working with the students, I couldn't read what they wrote. I couldn't see the board far away. At nighttime, if I drove, I could not drive very well at night because of the idea of blurriness. Blurriness was the big part of it. Also, I could not wear my contact lens, and I'm a big contact lens wearer, and I couldn't wear them. So that was kind of bad. I was worried that I would never see correctly again. It really bothered me. And I did not like that feeling. It was like headaches, totally. Going to my own eye doctor, he put plugs in. He did do that, and that helped some. But again, that, like doctor said, that was temporary. I used over-the-counter drops, which gets very expensive too, because you're putting your drops in and not really getting any results.
Right. For the actual treatment that you received during the procedure, how did you feel, and how did you feel immediately afterwards?
Well, I had dealt with this for over 6 years, really. And my own doctor did put me on Restatious or Rotatious, and it did nothing. And of course, we know how expensive that is. I first was very apprehensive at first because this was so new. But I have to thank Joe because Joe was the one at my work. I worked at Elements with him here in Storm Lake, and he said, Jan, have you ever thought about Dr. Ferguson? Because he does things with dry eyes. And I said, you know what? I'm going to look into that. And I will never go back. I was done with my doctor here, and he did not know enough to move forward. So I went to Dr. Ferguson, and it was the best thing I did in my life. I can't believe that it all went as well as I thought it would. I was very apprehensive, but Dr. Ferguson, like he said, he had it himself. So that made you feel good right there. He's been through this. And then also Marcy, his assistant, she made you feel so comfortable with the treatment. It was wonderful. And when I got done with the treatment too, it was very soothing. All you felt was just a little tickle across your eyes. And I said, I'm done. And she goes, yep, you're done. And I'm just like doctor. I got up and I thought, whoa, this feels fantastic. I want to keep this forever. But it took probably about 2 weeks before I really felt like it was being the best I could be with it. And it was great.
That's awesome. And talking about that 2 weeks later, what changes did you notice in your vision or comfort after treatment?
Well, for sure, I didn't have the feeling of rocks or gravel in my eyes. I could go out on a windy day and feel like, wow, I can be out here and I'm not feeling it. And the blurriness was gone. All the blurriness feeling that I had before was gone. I didn't have that. So it was awesome.
Amazing. Looking back, if you were to tell other patients considering going to Dune's Eye and looking at their dry eye disease condition, what would you tell them that you would wish that you would like to have known sooner?
Well, my friends that have it kind of get tired of me, but I said, I'm going to plug until you get this. I said, he is a great doctor in Dakota Dunes. I said, you need to try it out. Well, I'm glad you asked this question because I do have a good friend, and she was a co-worker with me at school, and she had the teardrop kind where she had tears running down her face. And she said, well, I don't know if it's dry eyes or not. And I said, yes, it can be. That's where you get confused because you think I don't have dry eyes because I got tears. But no, that is not correct. So she went to Dr. Ferguson and he helped her a lot. And I just talked to her yesterday to get some feelings. And she said it was the best thing she ever did in her life. She still has to tweak it here and there, but she said, she's in South Carolina now. And she said, I can't believe what a difference it made in my life. And I also suggest to people, a big thing I do is what doctor suggested to me was after I got done, before you go to him, you get this idea, any drop you put in your eye, anything you do, that's all there is. You can't do anything more. Well, we're all wrong. Because after seeing Dr. Ferguson, I found out I was using the wrong eye drops. He suggested Refresh that also has the omega-3 in it. And he said, no preservatives. Here I was using all the kinds that had preservatives in it. And all it was doing was caking up more on my eyes. So that was a big thing. And so any of my friends, I always tell them, they take out an eye drop bottle and I say, what are you using? And I said, don't use that. And they go, why? And then I tell them why. So I've learned a lot from him. And I also use the Avenova to wipe the eyelids. That's another thing that he suggested. I never thought of that before. Wipe your eyelids. Why? Well, it's because that's where the gunk starts building up and you can't have you'll have more dry eyes. Also, I take Hydro, which is a Hydro Eye that takes a pill once a day to help you with the lubrication of the eyes also. So both of those things were besides the LipiFlow and listening to everything he said about it.
Awesome. Is there anything else, Jan, that you would like to add about your journey?
I think I just would like to say that I am so impressed to have this put out for other people because I am where they were. I was scared. I thought I'd never see again. It was like you almost got scared about it, like your eyes are pretty important to you. And if you're going to let it go, that's not a good idea to do. And I can't believe what a difference it's made. And also, you need to know too, Dr. Ferguson does not do one-time LipiFlow and leave you alone and never talk to you again. Heavens no. I go to him every year. He totally does all the checks. I don't think people know that they don't blink enough. I found out I don't blink enough. So he puts me in a machine and it tells me how many I do in a minute or so. It was amazing. I thought I was blinking. He goes, nope, only half, or you weren't blinking enough. So his procedures go on beyond the LipiFlow. They help you to see that there's other things you need to check. Also, I was impressed by all the machines he has. Oh my goodness. You will be thoroughly checked. You get to see your eye and the whole performance of the eye, the back, the front, the sides. So Dr. Ferguson will check everything on you so that you know you're in good hands if something would start to begin to be a problem in your eye.
Awesome. I think we're slowly wrapping up here. If anybody does have any questions for Dr. Ferguson, let us know in the chat and I'll make sure those get answered. But otherwise, Dr. Ferguson.
Yeah, let me summarize, Jan. Hey, Jan, the check's in the mail. Holy smokes. What a beautiful testimonial to your experience. But you're not alone because there's so many patients out there that we have managed and your journey is similar, but you're a model patient because you're doing exactly what you needed to do post-treatment. And that's why your treatments lasted you so long. Plus, your skin type, your dermatology sets up beautifully for long-term benefits from just one LipiFlow treatment. And I think it's exciting. It's what brings you back every day to hear the impact, what it makes on patients' lives. I also am that patient. I know the power of having dry treatment and what it impacts me visually, but it's really, really cool. And I tell folks, do you need LipiFlow? I don't know. Most people do, but not everybody. So we just start with a diagnostic evaluation. We determine what your primary causes are. Sometimes it's a fairly straightforward thing. Other times it's more complex. And so we just have to do assessments, but very, very appreciative of Jan being here and sharing that because that's what we're looking for. That's the outcomes we're looking for when we're treating patients from an interventional standpoint.
And one more thing I'd like to say too, that doctor's office is a very warm and welcoming office. Everybody there wants to help you, including doctor. So when you go there, not only if you're going to have any kind of treatment or you're just going to have an eye test, and also glasses. I really like his glasses that are in his office. So be sure to check him out. He's at the Dakota Dunes. I totally respect Doctor and all the people that work for him. I just think it's the best thing ever for your eyes.
Great. Awesome.
Thank you. And we do have a question in here, but first, somebody did have a comment. This isn't a question, but I wanted to bring it up. They say that Dunes Eye rocks. So it's nice to see that in the chat.
Cool. Nice.
Question about eye drops. I've seen where there have been FDA recalls on eye drops. Is there a risk there, or what is the risk with eye drops?
Yeah, golly, they're kind of scary what happened because of the preservatives not being effective against, fungus and that kind of thing. So some of these off-label drops. So we have to keep that in mind. Do we offer patients to use a supportive? Okay, yes. Jan's using one that's going to be an adjunct to her when she needs it. It helps her out a little bit. But yeah, you got to be a little careful about that. So ask your eye doctor specifically about recommendations for which artificial tears to use if that's what's indicated for you.
So we also had somebody, this came from a comment on a post to promote the event, but I just wanted to bring it up, and Joe asked me to. They just said that it was the best thing they've ever done. Instant relief, just do it, was their comment. So I just wanted to share that.
Did you send that in, Jan?
And to wrap up here, for anybody who has been watching, who's been struggling with dry eyes or these symptoms for months or even years, what would you say is the importance of treatment versus just them managing it on their own?
Managing it on their own carries too much risk of visual disturbance and progressive ocular surface disease. I mean, that's the problem. If you're just bothered by a dry eye once every 2 weeks, need to throw a drop in, that's different. If you're consistently using drops on a day-to-day basis, you really need to seek out an eye care provider. You may want to do some research into providers that do provide a little bit more subspecialty in dry eye, because it is a focus. You have to be focused, and you have to take on the responsibility of having the appropriate treatments and technology to really do a good job. Okay. And I think that's something that I would encourage people to take a peek at. And your general eye care provider may be able to provide you some supportive care. That's just all you need. But many patients need more than that if they're really going to have a successful long-term benefit.
And
Perfect.
can I say that I think we need to know there's knowledge. And as you listen to Doctor, he's a specialist. That's what helps you. You need to have knowledge about what's going on with your eyes. They're the most important thing in your life. And if you start losing your vision or start having problems, what better way than having the knowledge of what's happening to you? And that's what I had. I had him tell me, you're not blinking. Don't use those kind of eye drops. You need LipiFlow. Tried it. It was awesome. So knowledge is a big thing. Try it out.
Great. I just want to summarize by saying thank you for the organizing everything. Thank you for Jan. You guys do a great job with these. And I think it's just important that we get the opportunity to share information to whoever and whoever gets to see this. But there is help. There is help. And the sooner you seek it, the better you are, because dry eye progresses throughout life. We just got to stabilize it and move the needle or the clock back as far as we can. And I think that's the important message. You want to feel better and see better. There's definitely help out there.
Great way to end it.
Great.
Thank you, everybody, for watching. Hope to see
Thank
you
you.
next
Thanks
time.
again, everybody.
Thank you.